My name is Rubens Petit, and I did my presentation on hepatitis B. Hepatitis B is a virus that affects the liver. It causes liver cancer, cirrhosis. The Merriam-Webster definition for cirrhosis is the disruption of normal liver structure. Hepatitis B causes approximately 1 million deaths every year worldwide. It causes about 5,000 deaths every year in the US. Although there is a vaccine available for hepatitis B since 1982, hepatitis B is mostly common in Africa and Asia. A little bit of information about the virus. The hepatitis B virus is from the Hepatinavirinae family. The hepatitis B virus is about 40 nanometers wide in diameter. The virus particles are generally spherical. Hepatitis B is a DNA virus. The DNA is circular, partially double-stranded with 3200 base pair. The first figure is a breakdown of the virus particle. The HBsAg is the virus antigens. These antigens envelop the core. The core is like the nucleus of the virus. It has the DNA, the red stripes of DNA, and the polymerase protein that's inside the core. The polymerase protein used during replication of the virus once it's inside the host, and the membrane protects the core of the virus. The virus generally affects humans. It is very resistant to both heat and pH. It can survive in both very basic and acidic solution. How does the virus transmit? Well, hepatitis B is generally transmitted to bodily fluids such as blood, semen, and saliva. The virus have an incubation period of about 6 weeks to 6 months. That is, it takes about 6 weeks before the disease fully develop. This slide shows a couple of common ways someone can be infected with hepatitis B. For instance, sexual contact. A person may become infected through unprotected sex with an infected partner with blood, saliva, semen, or vaginal secretion into your body. Other ways to get hepatitis B is the environment that you are living in. For instance, if you are around high places with high risk, such as Africa, there is a very likely chance you will come into contact with bodily fluid of infected people. And also, if you're living with someone with hepatitis B, then the chances are even greater. And other ways like body piercing from unsterilized equipment that can also result in infection. Well, this map showed the places with high to moderate risk of hepatitis B infection rate. All the yellow places fit under that category, and as you can see, basically almost everywhere in the world have a moderate to high risk of hepatitis B infection, apart from the US and half of Canada, a little bit of South Africa, we have Argentina and Chile, and the left part of Europe and Madagascar. Other than these places, everywhere else is not good. The symptoms for hepatitis B are abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea, vomiting, weakness, fatigue, and your skin and the white part of your eyes becomes yellow. Hepatitis B can either be acute or chronic. Most adults that contract hepatitis B develop an acute infection. The acute infection is not too bad. The disease usually go away after a while, but the chronic infection is a lot worse. It could last a lifetime, especially if you have a compromised immune system. It can lead to cirrhosis, liver cancer. Newborns and children under 5 are a lot more likely to contract a chronic infection than adults. And this is a photograph of a normal liver and one with cirrhosis. The one at the bottom is the one with cirrhosis. And as you can see, a liver infected with cirrhosis doesn't look too good. Got inflammation, a bunch of dots on it. And for treatment, if you catch the acute, but if you develop the acute infection of hepatitis B, well, there is not much necessary. Just get plenty of rest and drinks a lot of fluids and take a couple of pain relievers, and you should be good after a while. But for the chronic infection, treatment is necessary. Well, as of right now, there's 7 drugs that are approved by the FDA that help prevent cirrhosis, liver failure, and liver cancer. Those drugs listed on the slide, such as interferon alpha and pegylated interferon. And other treatment, well, as a matter of fact, it's not actually a treatment because it's been there since 1982. It's vaccination. So you get your vaccination done. And a couple of fun facts about hepatitis B is it kills one person about every 45 seconds. It is a lot more famous than HIV and also a lot more infectious than HIV. And together with hepatitis C, there's about 530 million people that have been infected with hepatitis B. If you would like to have more information about hepatitis B, those are some good websites you can use.